to talk about here, so I'm just gonna do transfers really fast and just go over, if you wanna sit, kind of setting up for a stand pivot transfer with the wheelchair at an angle. It's easier to go to the strong side, but you can't always go to the strong side. So just, just make sure, like if she's transferring over here to the weak side, you want her head and shoulders in the opposite direction. And just make sure you're blocking the weak side so she can pivot over. You can have a kid belt or not. I use pants, but you know. All right, so then she could just stand and pivot over. Good job. Oh no, it unlocked. Therapist. It unlocked.
I'm on the floor.
We hit the thing. Okay, and so then to go back, this is her strong side. So you want the patient to do as much as possible. Just block the weak side, have them reach over. So like she can reach this way, block the leg and just kind of guide the weaker side and pivot over. And same thing, if it's an amputee, it's not as important strong side, weak side there because their arms are usually equally strong. But just kind of at an angle and just do whatever works for the space. Don't necessarily worry about going a certain direction. Yes, every amputee should have the shield on who comes in. Yeah, okay, that was transfers. Unless you guys have questions or want to do it.
Joe came on the floor.
Huh?
So you want us to Joe came on the floor?
Kim on the floor, yeah.
Okay, so I'm just gonna go over a couple OT things. Right now, up on South 2, we have a really, really good patient with visual neglect, Mr. M. If you want to check out a room that's set up for that type of person, just kind of walk by his room and look at it. We actually have his bed coming out at an angle from the corner because he has severe left neglect. So based on where his door is at, we put that bed at an angle so that he can actually see from his right side out the doorway. Otherwise, he wouldn't know what's going on half of his world, or who's coming in or anything. The other thing with someone with left neglect, sometimes they have right neglect too. I'm going to focus on left. You want to make sure their call lights are always on the side they can see. So the arm that's moving, the eye that works, always on that side, because with this particular guy, it fumbles around at night and it gets lost on his left side, and then when you come in the morning, he's just like, I needed to call someone and I couldn't find my call light, and it's usually tucked right by his left arm. So they do get lost, so just if you make sure you hook it to their PJ top. So with him, when I leave him in bed for like his nap time, I'll hook it up here on the right side next to that top snap, and then pull it so that the cord's tight next to that little gadget that snaps. So it stays right there then. You will also see we have these splints. These are the ones that we issue out. They're color coded for all of these straps. So you really can't mess it up. We want to make sure that they wear this at night. We want to make sure that the straps are nice and snug, especially across the fingers, because if anything, with a stroke hand, the fingers kind of start melting down. So we want to make sure those are tight, and this one against the wrist. This is so if they have tone or tightness, their hand is staying in a nice neutral position. Otherwise, it would be crunched up like this all night, and that really actually hinders their recovery because all those muscles and tendons shorten up, and then they don't want to straighten back up for us. You will also see these little arm troughs on the chair. They'll usually have a tan pillow right inside. We want their arm nestled in there nice. We want the elbow back as far as it will go to keep the hand on top of the tray. We do not want to see this at all because that's the same thing. It's stretching the muscles and tendons, and that, again, hinders their recovery for being able to bring their hand up and close it. So the tan pillow will be on there. There's a Velcro at the end that actually goes underneath to hold the pillow on there, and the other two straps are on top to hold their arm on there, okay? This is another type of tray. If sometimes someone who's gotten tight in their arm, they'll start pushing up against this and it'll actually give them a sore or hurt them there. So we want to give them this lap tray that's like a desk. And then that just slides on and their arm can hold. Sometimes we'll put a piece of Velcro across it just to hold their forearm on top of there. We do not use the cup holder. The cups will not stay on there, so don't do that. Sock pullers, we've got two different types. We do give these notched ones out once in a while. So if you ever have any questions about how to use these guys, just let us know, because this is not something we give out a whole lot. But they typically would, if it's for one-handed, they're gonna hook their sock into that notch and then bring it around with one hand. So that's basically their hand, yeah, their fingers. And then they pull it up like normal. They're gonna throw that down, stick their foot in, and pull it right up over the heel. So, if you guys have questions on that one, just call OT. We have our reacher. We all know what these are. So, yeah, this is a magnet. Doesn't work super well, but they love it. The veterans love the magnet. And it, you know, we use it mostly to pick the pants up, pull it up their leg, thread it up until they could reach it, and pull it up the rest of the way. Long sponge. Some of the guys, we give these to, they do need it, but they like to save it for home. They don't want to unwrap it and use it here. So that's fine. I mean, they can use it and we can help them wash their back temporarily, but just so that they have that ability to use it. And the long shoehorn. So this can be used to also push their shoes off. They could just push that off there or stick it in there and the heel is going to slide right in. Any questions? Dressing equipment? Yes.
So for the room arrangement, when you like reposition the room, do you like communicate that with the nurses so they know
Yeah, so
that the bed is that
if the
way?
nurses have any questions, we will come down and help nursing do that. A lot of times, when the patient comes in, they're pretty, at least upstairs, because they get a lot more of the stroke rehab guys. They're more familiar with setting the room up. So this particular guy upstairs, some of the nurses already set his bed up in the diagonal fashion, but yeah, you would just call OT or PT and we'll come down and assist with that based on their visual neglect. If they're lucky, they'll get a room that they can see out the door on that side, you know, but if they can't, then yeah, we'll come down and help twist the bed and kind of make it where it's a lot safer for them.
And my other question, so if one of the residents should push their call light and I come into the room to help them, let's say for instance, if they just finished using the urinal and I dump the urinal and not knowing about this patient, how do I know when I get into the room to know, okay, when I'm done, make sure the urinal is
On the right side.
on the stronger
So
side
usually
of it?
OT will post signs up on the bed. So especially with someone who just has that down the middle line where they cannot see to one side, we're gonna post signs up on the light here above the bed to say to place things on the right or left side, whichever side they're seeing on. So like for this particular guy upstairs, I've got like 3 different signs. One is a plate of food that has it like cut down the half to remind people he cannot see on that side. And then another one's like a little checklist just to say, okay, call light, you know, and it goes down the line just to make sure everything's on that side that they can see. So if they're in therapy, we're gonna post reminders for the staff.
And if I'm going in to take out the tray and they have meal on one side of the tray, what would be the proper thing for a nurse to do? Turn the plate around?
Yeah, so usually someone like that'll be on Bon Appetit. I had that actually happen today. I was helping a guy. He thought, oh, I'm done. That chicken was really good, but he was still hungry. And I turned his plate a quarter, and he still had, lots of chicken on the plate. So those guys should be on Bon Appetit if they cannot see their whole tray to finish their meal on their own. But yeah, if you walk in with someone like that, it's just turning the tray so they can see it, the plate, and then recommending that they're in our Bon Appetit program.
because the patient didn't know that he had
No,
that.
he had no clue. He thought he was
Wow.
done.
Oh my.
So, and I will let Carla come over
So
here.
just
and go
talking
into
about
that.
the Bone App program, so usually nursing has been putting these on the patient's doors. It's usually Denise upstairs, I'm not sure who down here. But the Bone Amputee program is for anyone that is on a modified diet, anyone who needs tray setup, supervision while they're eating because they have swallowing precautions, they have swallowing issues. Sometimes it's just for encouragement. But a lot of times I will put in a text order on CPRS, like why they're on Bone App. But if they're on Bone App for setup and say it's just for physical issues, I'm not sure how that gets put into.
Usually they're typing up just for setup only.
Setup only,
Because then they
okay.
can be left after the.
Yeah. Because in my, like, under my evaluations, I will put Bone App, yes, and then specifically why, and then I'll take that entire chunk of information, including their diet, their liquids, and any safe swallowing precautions, and I'll put that, all of those things in the text order. But then I also make up one of these for every patient individually, because not all of them are the exact same. Some people need, you know, double swallows with each bite or each drink. But these are for the staff and they are for the patients. Some patients are not gonna read these, they're having trouble reading, so it's mostly for staff if they're being fed. But I will write up all of the things that we have to do in order to keep them safe while they're eating and drinking. I wanted to go over oral hygiene really quick. I have these pamphlets that are outside by all of the info out there. So back in the day, we used to only clean mouths with these toothaches. These are no-nos. That is not any way to clean a mouth. You have to clean with a toothbrush and toothpaste, whether they have teeth or no teeth or dentures. So even when their dentures are out of their mouth and soaking and getting clean, they are still to do oral care, cleaning their gums, their tongue, roof of the mouth with a toothbrush and toothpaste. When somebody has had a stroke, or if somebody has dementia and they are having trouble communicating, we like to start with some basic communication boards, and you guys have all seen these. I usually evaluate a patient and say whether or not they are appropriate for this or not. Like if they're blind, then of course they're not. If they can't read, then they would have trouble. So this is just a basic communication board to talk about pain, any pictures of things that they might want or need. This is basic needs and wants. If a patient is unable to communicate but they can spell out a word, they're having trouble with their speech and we can't understand them all the time, sometimes they can spell. We have just like, you know, months of the year, days of the week, a yes or no, you know, that they can point to, some information, you know, clock. We have other ones too that are kind of older. Any way that we can try to help the patient communicate, we try to figure it out so that, and then we'll tell you guys, like, this is the best way. Sometimes we'll use dry erase boards if a patient's very, very hard of hearing. Sometimes they need things to be written down, so we'll either use notebooks or dry erase boards. If they can write, but can't speak, we'll figure that out and we'll just, you know, educate you guys as we go, just accordingly. Any questions about swallowing or, yeah?
Do you have a large communication board that you
We have
utilize at times?
like these or bigger.
It's bigger. It
We
has
have
more.
big poster size ones that would not be appropriate for a patient's room. But I know like during COVID, there were some times in like some of the ICUs, we had special
Yeah.
communication boards for ICU patients during COVID. And then there are also ones that are large, like a poster size, and they could like point with a pointer if they were, you know, unable to speak during that time. But we don't have very large ones.
Okay.
No. But we have different size dry erase boards, and we have notebooks. I have big notebooks, I have little notebooks, and I just kind of see if it's you know, if it's appropriate for the patient or not, and then kind of go from there. Yeah, and if a patient's on our, you know, special liquids, then there'll be a sign outside their room saying if it's, mild or moderate, or, what's the other one?
B and,
Bad, really terrible bad. What's the other one?
nectar.
Well, it used to be nectar and honey
it's
and
different.
pudding, but we don't really,
Moderate.
yeah, now it's mild, moderate, and I don't wanna say severe, cause that's not it. Super duper thick, like pudding, but we rarely have those patients. That's all I have.
Alright, so I'll go for recreation therapy.
Oh my.
Yes, I'm here. So, for recreation therapy, we like to try to provide people with things that they can do independently in their rooms based on their leisure interests that they tell us when they come in. So, like some of the things that we offer: DVD players, which are usually the most popular, radios, variety of like woodcraft kits, leather kits, working on like some fine motor if that's appropriate. Coloring books, art supplies. We have a talking book, which is basically just like an audio book, but it's kind of more specialized for people with visual impairments, but anybody that can use it can use it. So those are just like some of the things that we can provide if you have a patient that, you know, knows, you know, they like to read and maybe they didn't mention it to me on their assessment. You know, that can just be something that you can mention to us. We can provide those things. And then the other really only thing is we try to do something every afternoon around 2 o'clock, around that time. So if you're getting a patient back in bed, you know, after lunch, maybe just kind of asking them, hey, do you want to participate in, you know, whatever group we're doing for the day before they get back in bed? Because sometimes when they get back in bed and then we come around and ask, they're back in bed, they don't want to get up, which sometimes they need it, but sometimes, you know, they just got back in bed, so they don't want to get back up. But we have like a weekly paper calendar that's usually on the bedside tables or sometimes in the trash can that falls in the trash can. But we update that every week, so you can always look and see what's going on for the day or the next day if someone's asking. And we keep the calendar up on the wall, like down the hallway on the left. You know, for the whole month, we update that every month. So that's, yeah, in the evenings, we have stuff on like Wednesdays and Monday evenings.
We have bingo on Sunday or music or something.
Saturday is bingo. But usually during the week it's afternoon groups, but then, you know, a couple times we have some stuff going on in the afternoon. Any questions in regards to?
Did you give Mr. McGuire those bracelet things? He was
Yeah.
making some
The
bracelets.
leather bracelet.
Yeah, a lot of them really like those leather kits.
They
Some of
do.
them are challenging, some of them are simple. So we have a variety, you know, for people of all abilities, whether they're able to do something more complex that takes multiple hours to do. We have something for that, or somebody that can only, you know, do something simple. We have stuff like that. So, anything else? All right.
They look forward to those bingo days.
They do.
They don't
like
win
those.
real money, but they don't win bananas either.